Hi, my name is Roxana Mehran. I'm professor of medicine, cardiology, population health science, and policy at the XIENCE School of Medicine at Mount Sinai, an interventional cardiologist. The Ability DM study, Ability Diabetes study, if you will, were the very, very first largest randomized clinical trial in patients with diabetes, randomized to 2 different stent platforms. Why did we do this study? Well, diabetic patients are at a higher risk for recurrent events. And we've seen that even with the best generation drug-eluting stents, that there's still some shortcomings. There's a novel device that combines the drug-eluting stent technology with a drug-coated balloon. How does this work? Well, it's called the Abluminus DES. The stent is crimped over the balloon, and then the drug and the polymer is applied over the crimped balloon and stent. So the idea is a homogeneous distribution, not just within the stent struts, but actually throughout the lesion and also at the edges. We performed this 3,000 patient randomized trial, all diabetic patients, mostly type 2 diabetes, some insulin-dependent diabetic patients. And what we found, very importantly, is that our trial was powered for non-inferiority, and we went up against the best-in-class XIENCE stent. The trial was performed during the pandemic, recruitment and follow-up, 3,000 patients over a 3-year period. And obviously it was very, very difficult, and we had the best investigators in so many different sites, over 100 sites around the globe, mostly in Europe and Asia. And we were able to get fantastic follow-up, 98% follow-up on everyone, but very, very difficult to get many of these patients back. So most of the follow-up was by phone. And very interestingly, the outcomes were important because we powered for non-inferiority. Unfortunately, we missed the non-inferiority endpoint. However, if you look over and see how these stents performed, they performed quite well. The target lesion revascularization for the test stent was at 5%, 4.7%, really low for diabetic patients. We had assumed about a 7.5%. And so it was much lower than expected. But the control stent did even better, like 2.5%, almost unheard of. So I think the takeaway is, while we didn't meet non-inferiority, that there was a really, really excellent, when you pay attention to diabetic patients, you do good work, you get good results. Both stent platforms did well. Of course, we missed non-inferiority. The big plan here is now, the original plans for the study was to follow everyone out to 2 years. We understand that in diabetic patients, there is a late catch-up, and these patients end up coming back more. So it's going to be really, really important for a 2-year follow-up, which really is where we're looking for. I believe that over the next year, these results will show the non-inferiority of these 2 stent platforms, but we're going to have to see. And I think I'm thrilled to see that there is such good outcomes in patients with diabetes with these 2 stent platforms.